Thank you for joining us for the September 2021 episode of the Dr. Fazil Show. And today we'll be discussing the new COVID-19 Lambda variant.
Yeah, so audience, that's true. We're going to be talking about a new strain of COVID-19 known as Lambda variant, which has been a dominant strain in certain countries like Peru. The Lambda strain is now a dominant strain in one of the country in, actually it's not just one country, but the dominant country at this point is in South America and from Peru. And it has been found in 35 other countries, including the USA and Texas. It's very concerning because this strain is also not only that it is new, it's more contagious than the Delta variant, plus it's also more deadly than the Delta variant was.
And Dr. Fazil, what is the biggest concern with the Lambda variant?
So the Lambda variant has 7 mutations instead of 3 mutations which Delta variant had. And we have also found that it is actually getting more smarter, and it is actually getting resistance to the current vaccination we already have developed so far. So the biggest concern is that if this variant becomes the dominant strain, which it would, as we have seen in the last predictions, that when the variant becomes very contagious, it does spread fast, and this is more contagious than the Delta variant. So I have no doubt that it would not become the dominant strain. That's why we just have to be careful. It is also concerning that it is not getting, people are not getting, who have got vaccination from the current vaccination, they're also getting sick with this new strain. So seemingly this virus has adapted to the vaccine we have developed so far. And that's a very, very concerning point, because if this thing spread like a jungle fire, then it can cause like a day zero situation. The day zero means that we'll have to start all over again, that start the new vaccination, a new approval process, new studies, and it might put us back in where we started from. So it's very important for us to keep this virus away from us by using the vaccines and then using the masks, and also hand sanitization and other customary precautions which we use to prevent other respiratory infectious diseases like flu or other cold viruses.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
And Dr. Fazil, in your opinion, are we looking at another lockdown?
Yes, that's a very much likelihood or possibility. We can see there's already a lockdown in Australia as we speak at the moment. Even with the Delta virus, they have Sydney and Melbourne under lockdown at the moment. It's not just the hypothesis, it's already happening. So even after a year and a half or 2 years of being in the COVID epidemic, we are seeing even in the developed countries like Australia, we are seeing the lockdowns. And as we speak, at the time of the show, recording of this show, they are in lockdown as we speak. So that's concerning because that is just with the Delta virus. And obviously, as I said, the Lambda virus is coming next. And who knows what's the next strain coming after that. But we do know that every single strain which have come because of the mutation or whatever another cause might be, it is causing more damages, Although we have seen some benefit from people who have got vaccination, but as the time is passing by, people which have taken 2 vaccines, their immunity is getting less and less, as with any other vaccine for any other ailment. So now they're saying that we should get a booster vaccine from the last shot if we're past 8 months. So after 8 months, everybody would need a booster shot. Before there was a guideline that only immunosuppressed people will get booster shot, but now the guideline has included everybody who has taken the 2 vaccines in the past and has passed 8-month mark. They should get the booster vaccine. Yes, that goes for all 3 vaccines we have got approved. And now we know that Pfizer has been approved for everybody. It has passed beyond emergency approval. So now it is just kind of like a regular vaccine at the moment.
And Dr. Fazil, what are the complications of the Delta virus that we've seen so far?
So the complications we have seen from COVID-19, we can look at other countries where they got COVID-19 infection and recovered. It is like, for example, we have seen that in India, they have got black mold, but we have got another variant of that, Canada auris in Texas. We have seen some cases there. When you get COVID infection, even though you recover, there's some residual side effects you get it from that. For example, loss of smell, loss of sensation of taste and smell, as well as issue with the breathing. People get scar tissue formation in the lungs, and they don't get the same stamina after they recover from the COVID-19 infection because of the damage to the lung. And some patients I have seen that they have to use oxygen, even they got fully recovered from the COVID-19 because of the extensive damage to the lungs. We have seen in other cases, it has affected the heart, causing inflammation of the heart. I've seen some cases with nerve palsies, like damage to the nerve causing facial muscle loss, like facial droop and facial palsies. So we have seen hematological side effects like blood clots in the lungs and the heart, strokes. So there's this virus is strange. I mean, we have never seen this kind of virus in the past, which can affect so many different body parts in the human body. It can affect the brain, heart, blood, lungs, muscles, and then in addition, we get other side effects due to the decreased immunity, as we said, fungal infection. So that's why it is very, very strange virus, and we're still learning it. That's why if the guidelines keep changing, it is no surprise, because it's just like enemy. If enemy changes the strategy, in the combat zone, we have to change the strategy as well to win this uphill battle at this time. I will call it uphill because this is not just the our national problem here is a global problem, and a lot of other countries which are not developed countries, like underdeveloped countries or third world countries, they don't have that infrastructure in the healthcare system, or they don't have that financial power to buy the vaccine and then have a distribution channel to give the vaccine to the population. And then we don't even have the data from them. So we don't even know what's happening. So if we don't know, doesn't mean it's not happening. So those countries have their own unique problems. It's not that they don't have COVID there and we don't hear from them. There are multiple causes we don't hear from certain countries. One reason is obviously they don't have that capability to get the data. People just die and they have no autopsies after that. They don't have any examination to see what happened. They are not doing the testing, and that's why those patients get not even registered as the death due to COVID-19. Also, certain countries have to suppress it because of the political reason or because of the financial reason, because they want to have their tourism being continued, and if they don't want to scare the tourists that we have COVID-19 here, so they tell, oh, everything is good, just come over here, and then blah blah blah, and then next thing you got COVID when you travel. So traveling at this time is probably not a very smart move. Stay put, if you can. I know people have COVID fatigue and they want to travel and they want to enjoy, but just think this is another, I will call it as another third world war or global warfare. I mean, it's not that we're fighting with another enemy, but we have seen two big wars in the past, and you have to do what you have to do to survive. And sometimes it takes sacrifice, and sometimes it takes extra measures to do that. And we have to do the same thing here now, because if we don't do it, this virus doesn't take any prisoners. No mercy with this. This virus have no mercy for anybody. So it does not. The mantra for this virus is take no prisoners. So everybody get infected. It doesn't recognize the skin color, borders, race, or ethnicity or gender. So we all have to be careful, work together, and fight together.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
And Dr. Fazil, what are the side effects that you've seen with the COVID vaccine?
Well, that's a good question. So some side effects are being published as at the national level or at the international level, like allergic reactions, blood clots, and stuff like that. I have seen some side effect in our practice as people passing out or heart rate dropping too slow, although we cannot definitely pinpoint to that yet, but I'm seeing a cluster of that thing happening. So that's why we'll keep our eyes open. We'll see if that's become a trend, and then we need to look deeper into that. But the only common denominator in those patients was that they have got vaccine, but nobody have had any fatal outcome. I mean, they all have low heart rate, but I mean, they didn't have any bad outcome or anything, but it is just something we are unable to explain. Only thing we can explain is that they have got the immunization for COVID-19 in the past. So either it happened immediately after that or a few weeks after that. So that's why there's a temporal relationship, but there's no definitive proof at this time. So I will still recommend vaccination at this time, but as a healthcare provider, I will keep my eyes open. We'll see how it goes.
And Dr. Fazil, do you know how fast the Lambda variant is spreading compared to the Delta variant?
Well, the Lambda virus we know is more contagious than the Delta virus, and it has already affected 35 countries. From the previous experience, we see that surge happens always after the long weekends in certain places when they do. For example, in India, the epidemic become more pandemic or more. We see more cases in India when they have the religious holidays or political rallies. That means when people are close together, those are the days when it spreads after that like a jungle fire. So you need a little kick start, and then it builds up momentum very quickly. It's like a tree. So we have to be careful, as we know the long weekend is coming, the Labor Day weekend, and other holidays are coming, especially in the winter time. So when people socialize more, and then they try not to use the mask. So that's my concern, that this winter might be, as we can see in our surrounding, that we are in a snowfield. So this is a reminder that we could end up in a winter like that, and so we have to be careful with this social events, national level or international level social events. Traveling as well become more prominent in those days. So people travel from different countries, and at that time it become a petri dish. The virus started to spread more. So it is kind of contained in the underdeveloped countries at this time. But as we have seen with the Delta variant, it happened right after there was long weekends, and it started to spread very quickly. So we have to be extra careful, and this winter, because of this new variant, and then also with this holidays which are coming, like Christmas and New Year Eve and other holidays in between. So that might cause or give opportunity to this virus to spread pretty fast. So, and we know we always have more. We actually didn't have a lot of respiratory ailment last winter. Actually, it was strange. And the reason was that people were using masks at that time. The mask was kind of mandatory. So we didn't see a lot of flu infection last year, unlikely than we were expecting it. And what happened was that when people were using masks, it not only prevented them to some extent from COVID-19 infection, but also prevented them from having the flu infection at the same time. So if we follow the same guidelines, I think we will be all right. But there's a new enemy out there, so we just have to be careful. Our strategy has to be more stronger and more tailored to the new variant, which is Lambda variant. And I think we will just have to go with the flow and see what happens. But all we can do is just follow the guidelines, get the booster vaccine, mask, and hopefully we don't get a winter like this as we are seeing now. That's my message to the audience. Be safe, stay strong, and God bless you all. Thank you.
Well, you heard it from Dr. Fazil. Let's continue to use our masks and practice social distancing. Stay tuned for the October 2021 episode of the Dr. Fazil Show. God bless.
Thank you.